Good day, and welcome to this year's open enrollment session, where we will be reviewing the benefits eligible for retirees over age 65. This year's open enrollment sessions are brought to you by Director of Personnel, Chief of Group Health Insurance, Ms. Valerie Daly, and GESC Health Insurance Board of Trustees. And as a reminder, this is the time of year that retirees can make changes to your employee benefits offered to you through the government insurance plan. Any change that you make is going to be effective October 1st, and then you just need to understand that you're committed to those elections, cannot make any changes from October 1st through September 30th unless you experience a qualifying event. Examples of a qualifying event would be if you get married, if you get divorced, if you have a baby. These are all examples of a qualifying event and a way that you can make a change to your coverage outside of open enrollment. So this presentation will be reviewing your medical coverage, which, good news, is not changing. It's staying with United Healthcare as a retiree over age 65. And as a reminder, the plan year begins January 1st for the United Healthcare Medicare plan. Your dental coverage is going to stay with Cigna. Your vision and your life are all going to stay with Standard as well. So real quickly, we're going to be sharing a video where Colleen is going to be reviewing your original Medicare basics, what to expect next, and United Healthcare materials.
Good day and welcome. My name is Colleen Montgomery, and I am an Account Vice President with United Healthcare. United Healthcare is honored to continue our partnership with the U.S. government of the Virgin Islands, and we are very excited to be speaking to you today about the United Healthcare Group Medicare Advantage PPO plan. At United Healthcare, we want you to know we are here for you, whether it's an appointment with a doctor, online, or a call with a nurse at 3 a.m. We connect you to the care you need, where and when you need it, by providing one-on-one support to help you understand your benefits. Your plan also includes your Part D prescription drug plan with no changes in the co-payments you have today. You will have access to all of the local pharmacies on island and access to over 67,000 pharmacies, including nationwide chains as well. You will have access to a large provider network, including doctors on island, as well as top doctors and specialists nationwide. With this plan, you can see providers in or out of the United Healthcare network for the same cost to you as long as the out-of-network provider participates in Medicare and accepts the plan. To confirm if your provider is in network, you can check online at www.uhcretiree.com/GBI or call the United Healthcare Customer Service Line. If your provider is not in the United Healthcare network, call the customer service team as they can reach out to the provider to confirm that they will accept the plan. This chart highlights some of the most commonly used services and the amount you would be responsible for paying when obtaining these services. For example, when seeking services from a primary care provider, you have a $0 copayment. Emergency room coverage is available worldwide and has a $0 copayment that you would be responsible for paying. Please note that Medicare prohibits members from being balance billed over what the contracted rate or the Medicare rate for services are. These are just some of the additional services that are covered at a $0 copayment that are included in the plan. The $500 hearing aid allowance is through United Healthcare Hearing. An annual physical is your opportunity to have labs and tests done to measure your health. Your annual wellness visit is your opportunity to set time aside for a conversation with your primary care physician to discuss options for preventative care and discuss screenings and exams you may have heard about or want to know if they're right for you. You may also be eligible for a gift card after completing the exam. Virtual visits allow you to have a live video chat with a doctor or behavioral health specialist from your smartphone, tablet, or computer, anything with a camera built in and a strong internet connection. Virtual visits are available 24 hours a day. Virtual doctor visits are included in the plan at no copayment when using one of our preferred vendors. You can speak with a provider, ask questions, receive a diagnosis, and the doctor can even prescribe medications and have it sent to your pharmacy. One of the programs included with your plan is coverage for diabetic testing and monitoring supplies. These supplies, such as lancets, lancing devices, glucose control solutions, and meter replacement batteries, are covered at a $0 copayment when you use OneTouch and AccuCheck approved systems. It is important to note that your prescription drug coverage is included in this plan. You have one ID card for both your medical and prescription drug coverage. Through UnitedHealthcare, you have access to a large national network of pharmacies, including pharmacies on the island, as well as 67,000 pharmacies nationwide that include all major national and regional chains. You will pay $10 for generic drugs, $40 for brand name drugs, and a 50% coinsurance up to a maximum payment of $95 for non-preferred and specialty drugs. You can look up the tier of your medication online at www.uhcretiree.com/GBI or by calling our customer service center. Medicare drug plans must include commercially available vaccines, such as a shingles vaccine, on their drug list, which is known as a formulary. Exceptions are vaccines that are covered under Part B, the medical plan, such as the flu and pneumonia vaccine. UnitedHealthcare offers a unique home assessment program called House Calls. A UnitedHealthcare healthcare practitioner will visit you in your home at your convenience. It includes a review of medical history and current medications and gives you the chance to ask questions and prepare for your next visit with your own doctor. This health program works in conjunction with your doctor's care and is not meant to replace it. After the visit, both you and your primary care doctor will receive a summary, and best of all, you will receive a $50 gift card just for completing the visit. Renew Active is your chance to stay both physically and mentally fit with a free gym membership, a personalized fitness plan, and online brain health programs exclusively from AARP that allow you to connect with other members at local and wellness events through the FitFit community. Our telephonic nurse support is available to help make your health decisions simple and convenient by providing answers to your health questions anytime, anywhere, available 24 hours a day, 7 days a week, at no additional cost. UnitedHealthcare Hearing allows you to receive a hearing exam and provides you with a wide selection of brand name and private labeled custom programmed hearing aids at significant savings. You can receive your hearing aids in person or delivered to your home. You will receive personalized care and follow-up support, helping you to hear better and live life to the fullest. To find a participating provider, please call our customer service center. Real Appeal offers two distinct digital weight loss programs, Real Appeal Weight Loss Support and Real Appeal Diabetes Prevention, which is a fully recognized CDC diabetes prevention program. Together, these programs create a comprehensive offering for members to manage their weight. Wellness Coaching provides a blend model of personal coaching, its self-paced online learning, and digital support across a variety of well-being topics such as healthy eating, sleep management, and more. Quit for Life is a clinically proven tobacco cessation program using an evidence-based combination of physical, psychological, and behavioral strategies to help members overcome their addiction to tobacco. Medicare has specific rules that must be followed, such as only allowing you to be enrolled in one plan at a time and you can find more details in the evidence of coverage document. Do you still want to learn more? You can visit the GVI Group Medicare Advantage PPO Plan Virtual Education Center and continue to explore. You will learn more about the custom programs available to you and watch videos from real-life United Healthcare members who share their personal stories of using several of the programs. You can access the Virtual Education Center from any tablet, computer, or smartphone by visiting www.uhcvirtualretiree.com/GVI. Once you receive your member ID card, you can go to www.uhcretiree.com/GVI and register. Once you have registered, you will be able to review your benefit information and plan materials, look up your claims after we've received claims to process, print a temporary ID card, or request a new one if needed, search for drugs and see how much they will cost under your plan, search for network providers and pharmacies, explore Renew by United Healthcare for information on health and wellness, as well as get your explanation of benefits online. You will be automatically re-enrolled into the Medicare Advantage Part D plan. However, you can decline coverage, but you will need to contact either the Division of Personnel Group Health Insurance, Virgin Island Housing Authority, or the University of the Virgin Islands in order to do so. You will have one ID card that was mailed to you after enrollment that should be used for all of your medical and prescription coverage. You will not receive a new ID card unless you lost your prior ID card and request a new one, or if you are a new member to the plan. We are here to answer any questions you may have at our Customer Service Center, which is open from 8 to 8 local time, 7 days a week at 866-827-9022. Thank you. We look forward to continuing to serve you as part of our Medicare family.
So now that you've heard Colleen review your United Healthcare benefits, I'm going to next go over your dental, your vision, and your life insurance that you have. So your dental insurance is going to continue to be offered through Cigna. And just as a reminder, there is a calendar year maximum equal to $1,250. I always like to point this out because if you're getting a lot of dental work done, you want to make sure you keep a close eye as to what Cigna has paid towards your dental benefits, because once Cigna pays out that $1,250 per person per calendar year, that's all they're going to pay towards your dental benefits, and you'll be responsible for everything else above and beyond that. Your vision coverage is going to stay with standard. As a reminder, it's always in your best interest to use a provider that's within the iMed Access network. And by going to a provider that's in that network, basically you can get your eyes examined at a zero copay. And then essentially, standard is going to be giving you up to $150 toward frames or $150 toward contact lenses. So you can either get frames or contact lenses. You cannot get both in the same year. So what some people do is they alternate. One year they get frames, the next year they get contact lenses. And then your basic life insurance is going to continue to be with standard. Retirees of central government receive a flat benefit amount equal to $5,000. And just as a reminder, make sure you always update your beneficiaries. As life changes and things occur, you want to make sure whoever you have listed as your beneficiary continues to be the person that you want to receive that flat benefit amount of $5,000. You also have the ability to purchase additional life insurance up to $150,000. If you're interested in applying for additional life insurance, you will have to complete an evidence of insurability. Basically, what this means is you'll be answering medical questions. We'll submit the answers to those questions to the standard. They'll review it and either approve it or deny the additional life insurance. We've got the website listed up here as www.standard.com/mybenefits/GVI. And there's just some really good resources that the standard is sharing with you on that website. So next steps is you want to complete an enrollment or change form to make any kind of change in your benefits that you would like. And again, just as a reminder, you will need to complete the evidence of insurability if you are interested in applying for that additional life insurance. And then if you have any questions, you can always reach out to Division of Personnel. St. Thomas, we have listed here at 340-774-8588. Or St. Croix, you can reach them at 340-718-8588. So thank you for taking the few minutes to review this presentation, and I look forward to seeing everyone in person, hopefully in the near future. Thanks.